Welcome to the Halton Healthcare Total Joint Replacement Journey. The goal of this video is to show you what to expect as you're traveling through the hospital. You're obviously having a joint replacement to eliminate or reduce the arthritic pain in your surgical joint. This can also improve your mobility, improve your quality of life, and as this is an elective surgery, it's important to adequately prepare for the surgery and to ensure home supports are in place. Preparing for surgery is important to your success in recovery. It's important to arrange a care partner, either a family member or friend, who can assist you at home for at least 2 weeks after your surgery. As well, it's important to purchase the recommended equipment you'll need for a safe recovery at home. Remember, all of the information about your upcoming surgery can be found on the Halton Healthcare website. This includes educational videos on topics such as going up and down stairs, getting in and out of car, changing or dressing after surgery, pain management, and exercises to complete before and after the operation. Our prehab team is always happy to answer any questions or concerns you may have. If you are deemed appropriate for day surgery, this means that you will be discharged home later the same day of the operation. If staying overnight in hospital, you should expect to be discharged early the next following morning. This video will walk you through all of the important stages in your journey of your total joint replacement here at Halton Healthcare.
The Rapid Assessment Clinic helps patients 18 and over living with hip, knee, and shoulder pain and provides timely access to an advanced practice clinician for an assessment and treatment plan. Patients must be referred by their primary care provider, either a family doctor or nurse practitioner. Within 4 to 6 weeks, patients undergo a comprehensive assessment by the advanced practice clinician. They're provided with education on their condition and recommendations for non-surgical treatments, such as changes to your physical activity, rehabilitation services, bracing, walking aids, and lifestyle modifications. Here, your surgeon will decide whether or not you are an appropriate candidate for a total joint replacement.
Pre-admission clinic. Approximately 2 to 3 weeks before your total joint replacement surgery, you will come into the pre-admission clinic. At the pre-admission clinic, you will meet with a nurse, perhaps a pharmacist, and an anesthetist. This appointment will take about 3 or 4 hours. When you arrive, please take a number to check in. Please ensure you bring the following items to your appointment: your health card, your package with your 2 completed forms, including the pre-op surgical questionnaire and your confidential admission form, a detailed list of all medications or the original bottles, and a care partner, either a family member or a friend, is also encouraged to join you at this appointment. At this appointment, you can expect to get your height and weight recorded. You may also have an electrocardiogram or ECG test and X-ray to help prepare for the surgery. You may meet with a pharmacist and an anesthetist. At this appointment, you may wish to register for our Meds to Beds program. This is an optional program you may choose to register for to have your medications delivered up to your bedside before going home from the hospital. Pre-admission will advise you on your surgery date and time of surgery, as well as confirm whether you are going home the day of the surgery or the morning after. Prehab education class. Prior to your surgery, you are expected to attend the prehab education class. This educational session is specific to patients who are undergoing a total hip replacement, total or partial knee replacement, and/or total shoulder replacement. This class is instructed by a physiotherapist. The class is given in small groups, and you may participate virtually via Zoom or in person. The session will cover important topics related to your upcoming surgery to help you better prepare for your recovery at home. At this class, you will learn where and when to book your outpatient physiotherapy appointment after your surgery, the importance of organizing a care partner prior to coming to the hospital, how to safely prepare your home, and as well as pre- and post-surgery exercises. If you have any questions about your upcoming class and do not yet have a class scheduled, please reach out to our prehab team at 905-845-2571 extension 5638 or email at prehab@haltonhealthcare.com.
Okay, so on the day of surgery, you want to arrive a few hours early before your surgery. If you arrive at the time of your surgery, you're late. And you're gonna have to bring a few things with you, okay? Make a list. OHIP card and your photo ID. Your My Guide to Total Joint Replacement booklet. A two-wheeled walker if you're gonna need it. If your surgeon recommended a cooling unit, you wanna bring that. Remember when you were a kid, you went to a sleepover, you brought an overnight bag, so you want your toiletries, your loose-fitting clothes, appropriate footwear like sneakers or slippers, something that encloses the foot. Glasses, hearing aids, dentures, a CPAP machine if that's what you need to sleep. And once you get to the hospital, you park in the parking garage, that's lot 6, and you can enter the hospital from the 2nd floor. Once you get in, walk towards the center elevators, turn right towards Area G, the ambulatory procedures unit. During the surgical preparation, you're gonna change into a gown. Someone's gonna help you or ask you to change into a gown. The nurses might start an IV in your arm. They might give you some preoperative medications to make sure that you're prepared for surgery, and you'll also be seen by the anesthetist. The anesthetist is the one that's gonna make you go to sleep or make sure that you have enough medication on board so you're not feeling anything during the surgery. And you're also gonna be seen by your surgeon right before your surgery. And depending on what procedure you have, your surgery might last up to a couple of hours.
If you have planned to have day surgery, then you will remain in the surgical day care unit where nurses will continue to monitor your vitals and assist in managing your pain. Your surgeon will meet you shortly after the surgery to discuss how the surgery went, followed by a visit from the physiotherapy team to assess your walking and practice going up and down stairs and to review exercises before you are discharged home.
If you're staying overnight at the hospital, you will be transferred to a room on the 7th floor, where you will be monitored by our healthcare team overnight. Your healthcare team will consist of nurses. These nurses will complete your dressing change and ensure that your wound is stable before going home. They'll also be monitoring your blood pressure, your oxygen, and temperature. They will monitor your pain to make sure it is well managed and help you get back and forth to the bathroom. Our physiotherapy team will practice getting in and out of bed and walking with the walker with you. The physiotherapy team will also ensure that you're safe to go up and down the stairs if you're required to do stairs at home. Your range of motion and strength will be monitored, and the physiotherapy team will go over the exercise program with you. You're responsible for continuing this exercise program once you go home from the hospital. You may also meet with one of our bundled care coordinators. They may meet with you to review your discharge plan. This will include making sure that you already have your outpatient physiotherapy appointment booked, as well as the necessary supports in place at home for a safe recovery. Before going home from the hospital, all members of our healthcare team will make sure that you are ready and safe to go home.
Approximately 10 to 14 days after surgery, you will have a follow-up appointment with your surgeon at the fracture clinic. The fracture clinic is located in Area D on the main level of the center block of the hospital. At this appointment, the surgeon will reassess your surgical joint, observe your mobility, ask about pain control, and reevaluate medications. And if you have staples, they will be removed at this time. Ensure you also take this time to ask any questions regarding your recovery.
Physiotherapy after your total joint replacement is vital in achieving the desired outcomes of the surgery. Your physiotherapist will continue to progress your exercises as needed to increase strength and range of motion, as well as to continue to reassess your walking and use of walking aids. Outpatient physiotherapy is recommended for all total joint replacements and may be covered by bundled care. Patients can also choose to attend a private clinic to complete their physiotherapy. However, this would be paid out of pocket or through patient's insurance. If you are unsure whether or not you are covered for physiotherapy, this will be reviewed during your prehab class prior to surgery. At all 3 of our hospital sites, Oakville, Milton, and Georgetown, WorkFit Physiotherapy provides outpatient bundled care covered physiotherapy to patients who undergo total hip, total knee, and total shoulder replacements. Keep in mind, physiotherapy is not done in isolation at the outpatient clinic. The bulk of your therapy will be your responsibility at home under the guidance of your physiotherapist instructions.